I was diagnosed with lupus in November 2015. The day before I was diagnosed, I probably could not spell lupus. I didn't know what it was. I didn't know how it affected persons, and I had no information or clue of the disease.
Everybody says lupus, but the full name of the disease is lupus erythematosus. And erythematosus refers to the redness that you get when the individual has an active rash, but not everybody has a rash. And lupus is an autoimmune disease. And what we mean by that is that the body's immunity is acting against the body itself, hence the term autoimmune. So that the immune cells, which normally would be fighting infection, bacterial infection, viral infections, fungal infections, and keeping the body healthy, these cells now target the various tissues in the body.
Doctor, who gets lupus?
Anybody can get lupus, and I'm talking the whole spectrum from childhood right through adult life, although the majority of our patients tend to present in their 20s and 30s, and you get a bit of waning of the incidence as people grow older. Anybody can get lupus. It is more common in women than in men. And of course, no race is exempt.
Is lupus an infection? Can you catch it from someone?
You don't catch lupus from someone. It's not an infection. The tendency to develop lupus, as with other autoimmune diseases, we think that this is genetic. But there probably are a number of other factors which come into play, which will make a person actually manifest with the condition. We know, for example, that sunlight has an important part to play in the appearance of the symptoms of lupus, and the condition is well known to get worse with the appearance with sunlight exposure.
What causes lupus?
The cause is unknown. The specific cause is unknown, but as I mentioned before, one, genetics. Two, it's possible that hormones may have an influence simply because we see it more often in women than in men. Sunlight, as I mentioned before, we really don't know what part other environmental agents may have to play in the disease. So I say in general that we don't know what the cause is.
What are some of the signs and symptoms of lupus?
The signs and symptoms vary, and not every patient will experience the same signs and symptoms. It starts from a basic fatigue, excessive fatigue, not being able to carry out your normal activity, fever, particularly in the evening, weight loss. Patients have rash. Most patients will develop rash at some time during their disease, but many of the patients never do have rash. A lot of people would have heard about the so-called butterfly rash, which is the appearance across the nose and the cheeks. But not every patient has that distribution of rash. The rash could be quite extensive. And of course, it is induced by sunlight or made worse by sunlight. Patients may experience pain and swelling in the joints. Depending on the other systems that may be involved, the symptoms would vary. If the chest is involved or the lungs are involved, they may have cough and chest pain. They may have problems related to the heart. They may have problems related to the kidneys. So one of the important manifestations is swelling of the hands, the feet, and the face. They may have involvement of the brain, in which case epilepsy or seizures may be a manifestation. If the blood system is involved, they may present with anemia. So it really depends on which system is involved.
How is lupus treated?
Lupus is generally treated by the group of drugs that we call immunosuppressants. So these basically suppress the immune system. And prednisolone is perhaps the best known of these drugs. Almost every patient with systemic lupus, and I need to distinguish systemic lupus from discoid lupus. Systemic lupus involves the body systems, and discoid lupus involves the skin only, and that kind of patient with discoid lupus tends not to have involvement of the rest of the body. So the treatment will vary depending on whether you have just discoid lupus or whether you have systemic. If you have systemic disease, you can expect to be on prednisolone, which is belonging to the group of drugs we call steroids. There are other immunosuppressants which can be used, including things like azathioprine. Some patients end up being on that. There is also methotrexate, and there are a number of other systemic drugs. One of the drugs called hydroxychloroquine is an anti-malarial drug. It was first developed for treating malaria, but then was found to be excellent for treating the skin and the joints in lupus. So many patients may find themselves on that drug as well. It is not so much an immunosuppressant, but it works really well for skin and joint involvement.
Is there a cure for lupus?
There is no cure for lupus, but we know that the disease can be controlled with these drugs either on their own or in combination. It is important for patients to stick to the regimens that their doctors may prescribe, and generally the condition will tend to improve, even to the point where patients no longer take medications. But this hinges on which system is involved and what drugs are used to treat it, and of course patient compliance with the medication. So while there's no cure for lupus, the disease can indeed be controlled.
Is lupus fatal? Can it kill you?
Lupus may be fatal in a small percentage of patients, and generally these are patients with systemic disease. And this is because sometimes the damage that is done by the immune system to the particular part of the body, in particular the kidneys, the heart, the lungs, these are and the brain, of course, these are the systems where there may be life-threatening involvement with lupus. Most of the time, because the immunosuppressant drugs are so good, one can actually control the condition so that the patient survives and does well. But in a small percentage of patients, the disease may be quite accelerated and they do not survive. But it is not a universally fatal condition.
If you know someone with lupus, what can you do?
I think it's important for patients who have lupus to have support. And the support of their families is invaluable in their recovery from the disease, because it is not every day that they will get up and they will feel well. So they need to have that support. We do encourage patients, once their disease is controlled, to continue life as normal. They should, continue normal activities. They should go to work. They should, of course, involve themselves in some form of moderate exercise within their tolerance level. They should know their bodies so that they can recognize when they have worsening of their disease, and that they can present to their doctors early for further control, for adjustment in the doses of the medication that they're taking.